Right then, let me start by saying I feel like I've been set up a little bit today because there is no way that I can follow some of the speakers that have stood up here. It was truly inspirational to hear what Wilma had to say and how Childline and the NACCC work for children and promoting the needs of children. So what we'll look at a little bit this afternoon is how we work in order to keep children safe within our centres. We've heard lots about what the risks are. Let's think together about how we work to keep children safe. So why do we do what we do? The people that volunteer or work on a paid basis to work with children and families do this essentially because they're good-hearted people. There isn't one of us that does this to get rich. There isn't one of us that does this because we like giving up our Saturday afternoons. We do this because we want to make children's lives better. And that's one thing that connects us all in this room. That's one thing that we're all passionate about. Working with children gives a sense of joy, and the emotional rewards are such that many of us couldn't ever imagine not doing it. We can't see a time when we won't be working with children and families anymore, when we kind of won't be striving to make children's lives better. Working and volunteering with children and families may well be one of the most rewarding things that we will ever do. As time goes on, we learn more and more about the innovative ways that people find to harm children. And we are learning about all of this at a time when there are less and less resources available to us to be able to protect them. And that's the reality of the environment that we work in at the moment, and there is every likelihood that things will continue to get harder before they get better. We've seen it over the last few years, and we kind of don't see significant evidence of things changing in the near future. This makes for an environment that can be really very stressful to work in. It can be totally overwhelming, and it has the potential to take over our lives if we let it. If we don't look after ourselves, it can become totally consuming. So I ask again, why do we work with children and families? We do it because we care. That's why I think we work with children and families. The children that we work with will have all been through very different journeys prior to them reaching our child contact centres. Some of them will have been on a journey that will have involved them working with social workers, that will have involved child protection proceedings. Others of them will have been through scenarios whereby they have experienced their family breakup. There's a likelihood that the children that have came to us will have experienced more settled times in their lives where their needs were being met more appropriately and where they were blissfully unaware of the problems that exist in the adult world. It's also reasonable to assume that they lived as part of a wider family that included maternal and paternal family members that they were seeing regularly and enjoying good quality time with. Maybe they've experienced living with two parents at some point in their lives. Maybe they haven't. Maybe they've experienced arguments and conflict in their home. And again, maybe they haven't. So what do their lives look like now then? Well, there's every likelihood that there's not as much money available in the family home as what they've been used to in the past. Maybe their family holidays and the things that they were used to and looked forward to have now stopped happening. Their lives are now characterised by change. They are meeting their parents in an environment that they don't know. That meeting of the parents is being supervised or supported by strangers. That must lead to a whole range of emotions that us as adults, I guess, would find it very hard to relate to. The adults that use our centres, they come with all of their emotional baggage, but they have the ability to be able to make sense of the things that have happened in their lives that lead to the way that they're feeling. Children don't have that same ability. And arguably, if children have formulated that ability at some point, we might be more so concerned about what it is that they've experienced that's kind of led them to that point. Their friends won't have experienced the things that they've gone through. And if they have, these children possibly won't know about it. Because talking about your family splitting up, talking about your world falling apart, isn't likely to be the hot topic on the school playground. It's not something that children are going to be talking about. They're also not seeing it in cartoons. They're not reading about it in their magazines. It's not in very many storybooks. So the world that they are living feels very insular. It feels very strange. They feel very different to other people around them. They're confused about why things have changed and what the future will be like. How many of them are wondering whether it's their fault that these things have happened in their families? Were they too naughty? Should they have gone to bed at a given time? Did they in some way contribute to what's gone on in their world? We know that they didn't. We know that children can't be held responsible for adult problems, but these are children and they haven't reached a point in their emotional development where they're able to make sense of those things. Okay. The risks that children face will be varying, and we've heard lots and lots about those risks today. For everybody who's amused, I am slightly immature and like to have far too much fun on PowerPoint. But in a nutshell, children are going to be possibly experiencing emotional abuse, physical abuse, sexual abuse, and neglect. But let's break it down more than that, because children's life is much bigger than those 4 categories of abuse. They're experiencing bullying, they're experiencing being different, they're experiencing academic stress. We live in a world where we push children from exam to exam, from a very early age when we start preparing them to sit their SATs. And that continues throughout their lives. And all of these things contribute to the stress factors and therefore the risk factors that children are experiencing on a day-to-day basis and that we might or might not see within our child contact centres. Children experiencing parental separation are also statistically more likely to be in poverty or living in poor housing. They're more likely to go on to be poorer themselves when they become adults. They're more likely to be susceptible to behavioural problems, possibly as a result of all of those emotions we were just talking about. They're more likely to perform less well at school. They're more likely to be needing ongoing medical treatment, more likely to be leaving school or home at a younger age than their peers, and more likely to becoming sexually active, pregnant, or a parent at an early age. So we can see that children experiencing parental separation at a young age sets them at a disadvantage. Not every child is going to experience all of those. Not every child will experience some of those, but it's important that we recognise that the fact that they've been through this difficult emotional journey makes them more susceptible to these things happening in their lives. It's well known that people who wish to exploit children will target those who are at increased vulnerability. It's well known that paedophiles and other people who want to harm children will access children from children's homes, will access children from separated families, will access children from other places, because these children are at a point in their lives, if one parent is missing from their world, then half of their potential identity is missing from their world. Children reach an age where they need to understand their identity, where they need to test out who they are and what they're about and what their values are about. And often children can find that in other places that we don't want them to find it. And we listened to one of our speakers earlier talking about county lines and how children so easily get drawn into county lines. I kind of repeat that message now because it's important that we understand that these children that get drawn into county lines, they're not the children that we're watching on Panorama. They obviously are, but they're also the children in our contact centres. These are normal children from normal families that we will or maybe have come into contact with at some point. I don't stand here and say this to you to try and scaremonger, but I feel it's important to say it because it's real. And if we're passionate about making children's lives better, then we need to understand the risks that they face and how we protect them from those risks. So in terms of risk assessment, there's an extensive body of evidence that shows how parental problems such as domestic abuse, substance misuse, mental health problems and learning difficulties can undermine parenting capability and increase the risk of significant harm to children. Research also suggests that where multiple problems interlock, the risk of significant harm is greatly increased. In social work field, they call it the toxic trio, and where you've got those first three things there together, the children that are living in those families typically are very worried about the level of risk for them in those environments are quite high. Parents who don't acknowledge their own experiences of abuse in childhood can also increase the risk that children are exposed to. And whilst we kind of know that those things are true, it's also important that people who experience these things, it doesn't preclude them from loving relationships and from effective parenting. And again, we heard that earlier today. The people whose children end up being vulnerable, it's not always because they're bad parents, it's not always because they're bad people. They go through difficult times in their lives. Children are targeted and picked up for different reasons. A piece of work that the government did in 2014, and I've got links to this at the end if anyone's interested, but they looked at the reliability of professionals' abilities to kind of pick up concerns. So this would be where you guys are at the point of receiving referrals, making risk assessments, thinking about how to provide support to families. And they looked at the reliability of practitioners' judgments concerning the risk of significant harm and the fact that overall they found that could be improved. Judgments based on experience and intuitive thinking should be supported, and that's something that we've heard time and time again through serious case reviews and the work of people like Eileen Munro. However, that's not to say that information collected through your more evidence-based tools and standardised measures, they're important too. It's a bit cheesy maybe, but I always try to kind of make sense of this by, if we imagine children's lives to be a jigsaw puzzle, everybody who knows the child holds a handful of pieces of that jigsaw. The teacher holds a handful, social workers hold a handful, parents hold a handful. And it's only by bringing those people together and encouraging them to speak and share information with us that they will share those pieces of the jigsaw. They want to work with us most of the time. A lot of them get very worried about confidentiality and GDPR, but they want to work with us, they want to share information with us. But quite often they will wait to be asked, they will wait to be invited to share what they know. And it can be an important part of our referral process that where we know some of these people are involved, that we take the time to kind of liaise with these people and gather up those extra pieces of the jigsaw puzzle to understand what's going on in a child's world. But most importantly, the most important person that we should be speaking to, the person that holds most of those jigsaw pieces, is the child. The child knows their world. They know the difficulties they've been through. They know the risks that they've been exposed to and how it's felt to do that. We all, regardless of what type of centre we're at, we all offer children a pre-visit. Children have a chance to come to our contact centres and have a look around. I'm not asking you to do wishes and feelings with them. I'm not asking you to do any intensive piece of work that you don't feel qualified to do. I'm asking you to ask them, to offer them some information about the service that they're going to receive and to ask them how they feel about that or if there's anything about that that worries them. Then I'm asking you to listen. Going back to what Wilma said earlier, we ask the question, we give them the time to listen. One thing that I have two different roles at Childline, one as a supervisor in Nottingham and one as a volunteer counsellor in Birmingham. And one of the standout things that I've learned during my times at Childline is that adults are really bad at listening to children. Teachers, social workers, parents, we're just rubbish at it. We feel the need to guide them, to mentor them, to advise them, to give them a sense of direction. And very, very often we find it really hard to just sit and listen and allow them that time to open up and to say whatever it is that's important to them. And that, for me, was kind of one of the take-home messages from what Wilma was saying. If we are serious about making children's lives better, and we're going to say to them, do you have any worries about contact? Make yourself available to hear the answer. There are other times for guiding, nurturing, monitoring, and all of those things. What we know from serious case reviews, just looking at this jigsaw puzzle, is that when we don't share the pieces of the puzzle, when we don't work with other professionals, ultimately children die or they come to serious harm. And it comes up far more often than it should. For about 20, 30 years of serious case reviews, one of the recommendations is, one of the findings is that professionals didn't work well together, that information wasn't shared, or there was gaps in information. We don't want to be another part of the system that does that to the children and families that use our centres. So, what does a good risk assessment look like? It's short, it's one page, if you write it too long, people won't either read it or understand it. And probably more so than that, if you've got a really diligent team of volunteers or staff that have read and understood all of it, how likely are they to be able to implement that risk assessment from memory when the adrenaline's pumping, when they've got an angry parent in their face screaming and shouting, when they can smell cannabis in your waiting room, when a bottle of whiskey falls out of somebody's bag, when the adrenaline's going, how easily are they going to be able to remember that risk assessment? The more simple you keep it, the more likelihood there is that they'll be able to do that. Free of jargon. I'm going to come back to it later, but people from social work type backgrounds particularly like to show off by using all of their technical language. They like to show how clever they are. It's pointless. Get rid of it all. Keep your risk assessments simple. Keep them to the point. Let people actually be able to understand them if there's any point writing them at all. They should be specific to family members, never generic. It is never okay to be having a copy and paste risk assessment that we're churning off time after time. It's pointless. The reality is some of our control measures might be very similar, and they might be things that we do anyway. So your staggered arrivals, keeping parents separate, the reviews to move cases on, they're things that we would do for each family anyway. But what you're doing is showing that you've given some consideration to what's happened for this family before they've reached you, and what you're going to do to keep them safe whilst they're with you. A risk assessment should always be more than ticking boxes. Ticking boxes doesn't really give any context. It doesn't really help me to understand why you're worried that a child might be abducted. A risk assessment should always be more than that, ideally. A risk assessment is completed by you. It is completed by your centre and not by other people who don't work at your centre. I've visited in excess of 100 centres by now, I would have thought, and I regularly hear from centres that have risk assessments on file that are completed by FCAs, CAFCAS officers, or that are completed by social workers. And they tell me that at the point the family was referred, those people knew the family better than they did. That's probably true, but it doesn't mean you shouldn't do your own risk assessment. Those professionals can be key to your process, but you know your staff team, you know your group of volunteers, you know the layout of your building, you know the resources that you've got available to be able to keep children safe whilst they're using your child contact centres. At the point of referral, the coordinator who deals with referrals at your centre is the expert in how that service will be delivered to that family in a way that appropriately meets children's needs. So I said short and to the point. That is an example of a short and to the point risk assessment. It might work for some centres, it might not work for others. What's important is that you find a template that works for your service and for the individuality of your service. It's a template that I've copied and pasted from other training courses that I use. It's deliberately very short and to the point. It gives no context, it gives no backstory, because that information is recorded elsewhere on the family's file. We don't need to duplicate information. What we need is a document that is easy to read and understand, that your volunteers will be able to remember and take away with them whilst they're working with that family. Your risk assessment should also be a live document, a document that you're reviewing regularly, because at the point when a family comes to your service, the risks might be quite high in terms of what your service will be able to take in terms of referrals. And that's because of the information you've been given, whether that be from the parents or from whoever the referrer was. The reality is, when we get to know families, often the level of risk changes. There are things that we worry less about. There are things that we worry more about. Once we start working with them, once we kind of get to grips with who they are, what they're about, and how high the children are within those list of priorities, and what they're willing or able to do to promote the needs of their children. We know it's perfectly realistic to expect that you could write a really lovely risk assessment and that things could still go wrong at your centre. And that's life, it's the world that we work with. We work with humans, and the fact that you've done a risk assessment isn't always going to stop that from happening. But what it is going to do is show some due diligence in terms of the fact that you took the time to think through what the risks were, and that you did all that you could to meet those risks. Sometimes things will happen that we just could never have risk assessed for. We just didn't know that that was a risk for that family. And again, we work with humans. Those things will happen. I am getting signals to shut up now and give way. So I will leave it there.